I was somewhat hesitant to use the TECNIS Multifocal when it first came out because of my experience with the +4 Restore. I was afraid that the near reading distance would be comparable to the Restore, which in my practice was about anywhere from 10 to 13 inches. To my surprise, the TECNIS Multifocal, my patients were reading very comfortably out to about 17 inches, and it's based on the design of the lens. One, the rings are located on the posterior side of the optic, and additionally, the haptic design places the optic more posteriorly in the capsular bag. Those two things allow my patients to read with their TECNIS Multifocal at a more comfortable distance.
Sure. Every few weeks, photographs of old paintings arrive at Martin Kemp's 18th century house. Yeah, this is crystal clear. And I can read it like here, well, like right around there.
Kemp scrutinizes each image with a magnifying glass, attempting to determine whether the owners have discovered what they claim to have found, a lost masterpiece of Leonardo da Vinci.
So now, Gail, if you wouldn't mind reading the same paragraph again, only this time we're going to dim the lights and see if you can read at a comfortable position.
Kemp scrutinizes each image with a magnifying glass, attempting to determine whether the owners have discovered what they claim to have found, a lost masterpiece by Leonardo da Vinci.
Every few weeks, photographs of old paintings arrive at Martin Kemp's 18th century house outside Oxford, England.
So Gail, now as a follow-up, would you mind holding the magazine out a little bit further and showing us how you're able to read at even a further arm's distance?
Many of the artworks are so decayed that their once luminous colors have become washed out. Their shining coats of varnish darkened by grime and riddled with spidery cracks. Kemp scrutinizes each image with a magnifying glass, attempting to determine whether the owners have discovered what they claim to have found, a lost masterpiece by Leonardo da Vinci.
I give my email address to my patients, and I'm often surprised that on the day of surgery, they're emailing me saying that they're able to see their computer screen, their telephone, the small fonts on their telephones, and they're commenting on their ability to see both at distance and near on the same day of surgery.
Under low contrast conditions, contrast sensitivity is reduced with a multifocal lens compared to a monofocal lens. Therefore, patients with multifocal lenses should exercise caution when driving at night or in poor visibility conditions.